Alright everyone, so Pediatrics is a place where they commonly ask questions. It's a tough shelf to do, and so we're going to go through a question here, which is super high yield and ties in a pretty high yield point, which got to know. So we got the question here: is a 6-year-old boy from Colombia presents with high fever, drooling, difficulty breathing. He sits leaning forward with his chin thrust out and mouth open. So that's a hyperextended neck and mouth open as well. Which of the following is the most appropriate next step in management? Okay, so diagnosis first. This is going to be a really high yield pathology that you must know. I've given you the triad, so the triad's going to be high fever, drooling, difficulty breathing, basically the tripod position. And so this is going to be epiglottitis caused by H. influenzae type B, so especially common in unvaccinated children. So how do we know this patient's not vaccinated? The USMLE love to say that basically any countries in South America or Asia, they say that vaccination rates are lower, so you assume that this patient might be unvaccinated. So that's the diagnosis here. So what's the next step? So if you remember your ABCs, airway, breathing, circulation, this is an airway emergency. So the first step you need to do is C. Secure the airway in the operating room, or secure the airway and start ceftriaxone. You need to most likely intubate because a lot of edema, epiglottitis, and then start ceftriaxone. Alright, so the other options, not important. What I will say is for B, administer epinephrine. This is going to be for croup, and croup presents with a barking cough, and fever may be there, may not be there, but most of the time it's there. But that's going to be the answer for B, is going to be croup. But the answer in this case is going to be C. Just remember drooling, tripod position, plus fever, epiglottitis. Make sure you secure the airway first. You don't need to do any imaging or throat exam. You need to manage the patient first. So that's the answer here. Hope you guys enjoyed it, and let us know if you want what topic you want next.